Welcome to this video series where we explore the NCSBN's clinical judgment model and relate it to the NCLEX exam. In this particular video series, we're going to look over test questions that go over the 6 cognitive skills that the NCLEX is evaluating you on, and we're going to go over concrete examples that actually come from the UWorld Nursing Test Bank. So let's go ahead and take a look at this. So here I am on the screen of the NCLEX RN test on UWorld. This is item 1 of 6 of the case study question that we're going to go over. And remember, we're always going to have the same 6 kind of questions on these case studies. So this first one will always pertain to some sort of recognizing cues or assessment, as if we would refer it to the nursing process. So in this case, let's go over this. The nurse is in the emergency department caring for a 62-year-old client. Here we have the history of physical, some findings that we have for this particular patient. And it goes from the body systems and into vital signs. And so here then on this other side, we are supposed to click to highlight the 4 findings that require follow-up. In this particular case, this patient is alert and oriented to person, place, and time and situation, but they report a sudden onset of right-sided facial drooping 1 hour ago, slurred speech, positive right-sided arm drift. So right away, your alarm bell should be going on and saying this is an abnormal assessment finding. The EENT pupils are equal, round, and reactive to light and accommodation. So that's normal. Vital signs look pretty normal. Lungs are clear. More vital signs here with the temperature, blood pressure, and heart rate. A little bit of an elevation in blood pressure, but nothing too concerning. S1 and S2, no murmurs. History of hypertension. And then for musculoskeletal, we have right-sided lower extremity weakness, endocrine, history of diabetes. And then psychosocial, they drink 1 glass of wine each evening, no tobacco use, and a history of major depression. So in this case here, it says click to highlight below the 4 findings that require follow-up. And findings always pertain to assessment. So something on the assessment that is abnormal. And as you can see, I've already gone through this. So this right-sided facial drooping that started 1 hour ago with slurred speech, positive right-sided arm drift, and right-sided lower extremity weakness, highly suspicious of a stroke. So hopefully anybody would recognize this. And this is how this case study starts. And then we're going to look into question 2 here in the next video, where it actually goes through this process of the recognizing cues and the nursing process into the other phases of the clinical judgment model. So please stay tuned for that next video here on UWorld Nursing, and also check out Nursing School Explained for further resources.